Hi, my name is Travis Pearson, and this is a presentation on Chagas disease. Now, some of you may have been familiar with or have even heard or watched the show 1000 Ways to Die. Well, one of the segments on that show actually featured Chagas disease as one of those ways to die. So, after the presentation, you can go on Google or YouTube and check that one out. So, on to Chagas. Wait, no. Chagas disease, not Chucky. Where you. Get out of here. Go find a birthday party to ruin. Now, anyway, about Chagas disease. It's also known as American trypanosomiasis, so as not to be confused with African trypanosomiasis, which, as its name implies, originates in Africa and is associated with the tsetse fly. Chagas disease originated in Latin America and has since spread to the US and other countries. The disease affects 8 million worldwide and is known as a neglected tropical disease, which are diseases that are highly prevalent in tropical developing regions. This disease was named in 1909 after the discoverer of the disease, Brazilian physician Carlos Ribeiro Justiniano Chagas. And as you can see, the spread is originated in Latin America and mostly concentrated in Mexico, Brazil, and Argentina, and it's spread all across to the United States, to Europe, and even as far as Japan and Australia. So how can Chagas disease be transmitted? Well, the most common path of transmission is through this cute little critter called a tridamine bug, aka the reduvin or the kissing bug. It's cute, isn't it? Well, this bug is active at night, and much like the bed bug, feeds on blood. If you're familiar with the idiom "don't crap where you eat," well, the tridamine couldn't be bothered with that. The bug defecates around the wound as it's feeding, and that species contains Trypanosoma cruzi parasites. A natural instinct of us humans is after a bug bite to scratch the area. Well, as you scratch, the feces will infect the wound, and the T. cruzi parasites will enter the bloodstream. Transmission can also occur through blood transfusion, congenitally from mother to fetus, organ transplants, food contaminated with the T. cruzi parasites, or lab accidents. Chagas disease has two phases, acute and chronic. The acute lasts around 2 months, and here is where you usually find the classic symptom of Chagas disease, the swelling of one eyelid. You also have symptoms that come and go, like rash, fever, nausea, diarrhea. Though if treatment isn't sought at this phase, then it advances to the chronic phase, at which point the parasites are embedded within the heart and digestive muscles. About one third of people who have not been treated will develop chronic Chagas. This is where you have the more severe complications, such as a myriad of heart and digestive problems. The chronic phase can take place decades after initial infection, and sometimes symptoms may not even occur at all. We are able to confirm presence of Chagas disease through a simple blood culture or chest x-ray. ELISA, EKG, and blood smear can also be performed. These tests are used to determine presence of T. cruzi parasites, or the antibodies that are made to fight these parasites. Of course, a combination of these tests are necessary to confirm diagnosis. So, the people who are most at risk for Chagas disease includes those living in poverty-stricken rural areas in Latin America, and people living in poor quality housing made of adobe, mud, or thatch where tridamine bugs will reside. People who receive blood transfusions or organ transplants could also be at risk, but the risk is not as high due to screening and testing. Some strategies for preventing Chagas disease include living in better houses, using insecticides and bed nets treated with insecticides, protective clothing, and insect repellents. As mentioned before, blood banks utilize screening for donors who could potentially have the disease. There are two approaches to manage Chagas disease, one for each phase. Antiparasitic treatment is used for the acute phase, and the administration of benzidol and nifurtimox are used to kill the parasites. Both are almost 100% effective in curing the disease, but they become less effective the longer a person has become affected. Symptomatic treatment is used in the chronic phase to manage the heart and digestive issues that are associated with this phase. So things like pacemakers and medications will be given to patients in this stage. However, antiparasitic treatment can also be used in the chronic phase to limit the progression of the disease. So, to conclude, night night, don't let the trying bugs bite. Thank you.